Good afternoon, everyone, and thank you for joining us. We are going to get started. My name is Nicole Payonk with the Pennsylvania Coalition for Oral Health, and I'm delighted to welcome you to today's webinar, Dental Workforce Evolution in Pennsylvania, a Decade of Change and What Lies Ahead. Before we dig in, just a few housekeeping notes. Please keep your microphones muted to minimize any background noise as today's session is being recorded. Following the webinar, the slides and recording will be shared with the registrants. And additionally, we are going to have time for discussion after our presentation. So I encourage you to submit any questions using the Q&A feature located at the bottom of your screen. Let's begin with a quick look at today's agenda. First, we're going to be setting the stage for our discussion before moving into our speaker presentations, where Dr. Jennifer Burroughs will be presenting findings from the 2023 Dentist and Dental Hygienist Workforce Survey. Then Helen Hockey will guide us through workforce trends, analyzing data from the past decade. Finally, we'll close by identifying opportunities. This is the part of the webinar where I invite you as stakeholders and professionals working in this space to help us translate these findings into meaningful action. So we do have a lot to cover. Let's get started. So as we consider today's conversation, I always find it helpful to revisit the Pennsylvania Oral Health Plan 2020-2030, which outlines 3 strategic priorities. Priority B, the focus for today, centers on strengthening the oral health workforce. Now, this framework is not only a roadmap, but it is our reminder that workforce development is more than just a current challenge. It's an opportunity for us to better the future of oral health across the Commonwealth. So if we want to take a look at a snapshot of how the current workforce challenge looks in terms of being able to access dental care, here's what we're seeing. Over 1.6 million Pennsylvanians live in designated dental health professional shortage areas. And that means that over 35% of our residents are not getting the care that they need. Although we are able to produce about 350 dental graduates each year from our Pennsylvania-based dental schools, this number still falls short of what we need to fill our provider gaps. In fact, the gap in dental provider remains 4 times greater than what we see for primary or mental health care. The data makes it clear. Strategic dental workforce development remains a top priority. So before we move to our speakers, I do want to reflect on an important milestone. This webinar series was born out of a statewide workforce strategy session hosted by PCOH nearly 2 years ago. Many of you actually probably participated in that session. And what we learned from bringing together the diverse voices that represent Pennsylvania's oral health landscape was that there are 3 guiding themes everyone in this space can agree on. And those themes centered on training, retaining, and recruiting for our oral health workforce. Since that initial meeting, these collective themes have driven our work. And the data our speakers will be sharing can further help shape our coordinated efforts to achieve the ultimate goal in our Pennsylvania Oral Health Plan, which is to have a sufficient, diverse, and competent workforce, both public and private, to meet Pennsylvania's growing oral health needs. So now that we've set the stage, I am so excited to hand things over to 2 expert speakers who will be able to walk us through the data that has been driving our work forward. First, we'll hear from Dr. Jennifer Burroughs, Epidemiology Program Specialist at the Pennsylvania Department of Health. She brings deep expertise in oral health data and will be sharing highlights from the 2023 Dentist and Dental Hygienist Workforce Survey, offering an insight into the current landscape and emerging patterns. So please welcome me in joining Dr. Jennifer Burroughs.
Oh, thank you, Nicole. That's a very kind introduction. And I'd just like to thank the Coalition for inviting me to speak with you today. It's a pleasure to work with this fantastic group. Like Nicole said, my name is Jennifer, and I work with Dr. Jun Yang. He's our chronic disease epidemiologist at the state, and we work to provide epidemiology support to programs in the Bureau of Health Promotion and Risk Reduction. Again, I'm delighted to share findings from the 2023 Dental Workforce Survey with you today. We'll discuss the survey design and some highlights from both the dentist and the dental hygienist sections, and then we'll touch a little bit on access to dental care. Let's get started. Next slide, please. Don't know if it advanced. Next slide, please. Okay, awesome, thanks. Might have a delay, apparently. Alrighty, so the Dental Workforce Survey collects information on the characteristics and distribution of the dentists and dental hygienists in the state. It's a collaborative effort between the Department of State's Bureau of Professional and Occupational Affairs and the Department of Health's Office of Primary Care. The data is collected every 2 years when dentists and dental hygienists renew their licenses to practice in Pennsylvania. The data collected includes information such as demographics, type of employment, and practice focus and location. After the data is collected, the Office of Primary Care cleans it and removes surveys without a valid license number or those with inactive or expired license numbers. The data is then shared with the oral health program team at the department, as well as us, the EPI team, where we clean it a bit further, we run different analyses, and then we produce the workforce report. The data that's included in the report is provided only in the aggregate form, meaning it's reported as a group and individual level data is not reported. This first surveys were administered in 2003, and some of the questions have remained very similar across the years, but some questions have been added or changed as time's gone on. Next slide, please. Like any study or survey, there are some limitations to consider. For example, the survey is administered to professionals who are renewing their licenses. So first-time licensees are not included, so we won't capture their information until the next license renewal period. That's important to keep in mind when we look at the age distribution of our respondents. Those new graduates tend to be younger, but unfortunately they won't be surveyed until their license is renewed up to 2 years later. So we may not be capturing all of the professionals in the younger age group. Bias can occur in a survey when we have a respondent who misremembers information or does not respond to a question. And while the survey is a mandatory component of licensure renewal, some of the questions are optional. So we do have variations in sample sizes and response rates that result from that missing data. Question design can be a limitation as well. For example, a few of the questions have an other option where respondents can input text of their choice. And this can sometimes lead to responses that are difficult to group appropriately or are erroneous. Let's talk about those results. Next slide, please. We'll start with our dentists. We had 9,002 valid surveys returned in 2023, and of those, 2/3 of the respondents were male and 1/3 were female. The average age was 52 years, and the predominant age group was 30 to 39-year-olds. They comprised almost a quarter of the workforce. Only 4% of our respondents were between the ages of 25 and 29. But again, keep in mind that age distribution limitation. Looking at the distribution by sex, 2/3 of male dentists were age 50 or older, and 1/3 were 65 and older. In comparison, only 1/3 of female dentists were age 50 or older, and the percentage of females in both the 30 to 39-year-old and 40 to 49-year-old age groups doubled that of males. By race and ethnicity, the majority of our respondents were white, followed by Asian, Black, and Hispanic Latino. Next slide, please. When we narrow our respondents down further, over 90% of them are employed in dentistry, with the majority employed in direct patient care. Other employment areas include academia, administration, and research. If we look at national numbers, our rate of dentists per 100,000 people is slightly higher at 65 versus 60 per 100,000 in the overall United States. Our sex demographics vary slightly as well. We have slightly higher percentages of males and lower percentages of females compared to the rest of the United States. Next slide, please. Comparing the racial and ethnic distribution, Pennsylvania has more white dentists and less of the other racial and ethnic groups compared to the nation. Next slide, please. When we drill down just a little bit further, 73% of our dentist respondents provided direct patient care in Pennsylvania. The average age was 51, and 22% of dentists were age 65 or older. Looking at the distribution by sex, females aged 30 to 39 make up the largest group at 36%, and the smallest group is males aged 25 to 29 at 3.4%. The number of male dentists tends to increase with age, while the number of female dentists tends to decrease with age, starting at age 45. Next slide, please. By race and ethnicity, 71% of direct patient care dentists self-identified as white, followed by 14% Asian, 2.3% Black, and 2.2% Hispanic Latino. When we look at how this compares to the distribution of different racial and ethnic groups in the state, the percentage of white dentists is proportional to the white population, while the percentage of Asian dentists is higher than the Asian population, which is 3.5%. And the percentage of Black dentists and Hispanic dentists are lower than their respective populations, which is 11% for the Black population and 8% for the Hispanic population. Next slide, please. By practice area, 3/4 of the dentists practice general dentistry, followed by orthodontics at 6% and oral surgery at 5.4%. So that rounds out the top 3 practice areas. By sex, there were more males in each practice area, except for pediatrics. Females predominated in pediatrics. By hours worked, 18% of oral surgeons reported working more than 40 hours per week, which is the highest percentage of respondents working this amount. On the other end of the spectrum, orthodontists claim the top spot with 11% working 1 to 2 hours per week. 1 to 10 hours per week. Next slide, please. When you look at our services provided, 41% of our direct patient care dentists treat patients with limitations or disabilities. 85% of them treat geriatric patients, and 87% of them treat children. The age distribution of children seen varies, though, with 1/4 of dentists reporting that 5 years old was the youngest age child they treat, and approximately 1 out of 8 dentists did not see children of any age. 14% of our dentists reported providing volunteer services, with older age groups volunteering more than our younger age groups. Next slide, please. All right, let's talk more about these dental health professional shortage areas Nicole mentioned. So the federal government defines a dental health professional shortage area as a population to provider ratio of at least 5,000 to 1. And there are 3 different types of designations: geographic, population, and facility. Geographic shortage areas are designated when there's an entire group of people within the geographic area. Population designations are for a specific group of people, such as low income, unhoused, or migrant farm workers. And facility designations are for facilities such as federally qualified healthcare centers, rural health clinics, or correctional institutions. Here in Pennsylvania, we have population, specifically low-income population, and facility designation types. We have 148 storage shortage areas across 42 of our 67 counties, and we rank 20th in the nation for the number of shortage areas that we have. Next slide, please. When we look a little bit deeper, shortage areas are given priority scores for the assignment of health professionals. The scores range from 0 to 26, where a higher score indicates a greater priority. And the scores are based on 4 different criteria: population to provider ratio, percent of the population below 100% of the federal poverty level, water fluoridation status, and travel time to nearest source of care outside the designated area. Our highest scoring area is in Philadelphia County and contains 45 census tracts. Our lowest priority score is Venango County, but it is the entire county of Venango. The number of full-time equivalent practitioners needed in the shortage areas to achieve that target ratio is also calculated. And remember that target ratio is 5,000 to 1. So the most practitioners are needed in Philadelphia County, specifically District 5, which contains 83 tracks. 31 practitioners are needed to hit the target ratio in this area. And the lowest number of practitioners needed goes to 2 townships in Franklin County, where they need at least 1 to meet that target ratio. Next slide, please. When we look at this geographically, we have close to 51 dentists providing direct patient care for every 100,000 people throughout the state. This map breaks that down to the county level. So counties in lighter green colors have fewer dentists per population compared to counties that are represented by darker green colors. Montour County has the highest rate at 143, and Fulton County has the lowest at 7 direct patient care dentists per 100,000. Of note, there are no dentists practicing in Juniata County. The 42 counties with shortage areas are identified on the map with a hot pink border. And in those counties, there are only 48 dentists per 100,000, compared to non-shortage areas where there are 55 dentists per 100,000. It's important to keep in mind those types of shortage designations when we evaluate the rate of providers in different locations. So for example, when we look at Philadelphia County, it's in the second highest group with 47 dentists per 100,000. So it might lead you to conclude that they're doing okay in their number of practitioners, but we learned earlier that parts of Philadelphia County have some of our highest priority scores. So while there may be a fair number of practitioners, there's still not enough to meet the needs of our low-income population in the county. Next slide, please. So this is that same map as the previous slide, but with the rate of dentists shown the same, except we're going to look at rurality. So rural is defined as having less than 291 people per square mile. And we have 48 counties that meet the definition of rural. These rural counties have a purple outline, and the urban counties have a yellow outline. Pennsylvania is a little unique in our distribution of urban and rural counties. So most of our urban counties are in the southeast and south central area. There are a couple in the northeast, the greater Pittsburgh counties out west, and then Erie County in the northwest are our urban counties. And the rest of the state, which is the majority, is considered rural. Only 18% of our dentists provide direct patient care in these rural counties. And the rate of dentists there is 35 per 100,000. And for those 82% practicing in urban counties, the rate is much higher at 56 per 100,000. Next slide, please. Okay, we will move on to our dental hygienists. Next slide. Right, we had just over 8,700 valid surveys returned, and the overwhelming majority of dental hygienists were female. The average age was 46, and 70% of the hygienist respondents were between the ages of 30 and 59. Looking at the age distribution by sex, the distribution was generally equivalent across the age groups for females. However, there were more males in the younger age groups. By race and ethnicity, the majority of respondents were white, followed by Hispanic, Latino, Asian, and Black. Next slide, please. When we look at employment areas, 88% of our respondents were employed in dental hygiene. Of those, 95% were employed in direct patient care. And similar to dentists, academia and administration were 2 of the other primary employment areas. Next slide, please. Focusing in a little further, the 86% of hygienist respondents provided direct patient care in Pennsylvania. So our average age distribution there was 45. And the overall, the average age was 45, and the overall distribution was fairly equivalent. When we break that down by sex, the percentage of male hygienists is higher in the 18 to 29 and 30 to 39-year-old groups than the older groups. So perhaps we're seeing more males enter the profession. Only 13% of female hygienists make up the youngest group of 18 to 29-year-olds. Next slide, please. There's not much difference in the racial and ethnic makeup of direct patient care hygienists versus all hygienist respondents. White non-Hispanic is the most prevalent group, followed by Hispanic, Latino, Asian, and Black. Next slide, please. So through additional training, And requirements, hygienists can obtain different certifications and permits. Half of the direct patient care hygienists hold permits to administer local anesthesia under the direct supervision or authorization of a dentist. Close to 3% of hygienists were certified school hygienists, so they can provide preventative hygiene services to students pre-K through grade 12. In 2009, an amendment to the state's dental law was introduced, and it provided new capacity for hygienists to be licensed as public health practitioners. This licensure was created to increase access to dental services in shortage areas. So these practitioners may perform educational, preventative, and therapeutic services without the supervision or authorization of a dentist. The law specifies that they do have to refer a patient to a dentist at least annually. And it also specifies practice locations where they may work. So that includes, but is certainly not limited to, schools, correctional facilities, hospitals, and assisted living facilities. Of the almost 11% of licensed public health practitioners, 30% of them reported working in that role primarily, and 7% of respondents in the survey reported that they intended to apply for the license. Next slide, please. Looking at geographic distribution, this map displays the number of hygienists per 100,000 with the same color scheme as the dentist maps from earlier. The statewide hygienist rate is 51 per 100,000, with Montgomery County having the highest rate at 75 and Forest County having the lowest at 15. In shortage areas, the hygienist rate is 46, and in non-shortage areas, the rate is 57 per 100,000. So similar to what we're seeing with dentists. Next slide, please. By rurality, more hygienists than dentists practice in rural areas, with 23% practicing in these counties versus only 18% of our dentists. And the rate of hygienists in rural counties is 45 versus 53 per 100,000 in the urban counties. Next slide, please. All right, we're going to switch gears a bit and we're going to talk about access to care. Next slide. So this map presents 2022 data from the Behavioral Risk Factor Surveillance System. This survey is administered annually by the CDC to collect health outcomes and risk factors among adults in the United States. The map represents the age-adjusted prevalence of adults surveyed in 2022 who reported having a dental visit during the past year. So our darker colored counties have lower percentages of dental visits. And we have 18 counties where 40 to 50% of adults reported not having a dental visit in the year prior. All of those counties are rural, except for Philadelphia. Next slide, please. This map also presents data from the 2022 BRFS survey. So this is adults over the age of 65 reporting that they have lost all of their teeth. Counties with the highest prevalence are the darkest blue color, and all but 4 of those, which are Lackawanna, Luzerne, Lehigh, and Philadelphia, are classified as rural. Mifflin County has the highest prevalence, with 1/4 of adults reporting they have lost all their teeth, and Montgomery County has the lowest prevalence at 7%, reporting the same outcome. Next slide, please. So looking forward, we can use our survey information to identify gaps in our workforce and areas where it needs support and maybe further developments. We have differences in our workforce demographics, and trends have been changing over the years, which Helen's going to touch on further. We have counties and geographic areas where practitioner shortages need to be addressed. So we can encourage practitioners to practice in these areas through things like student loan repayment programs. We can encourage entry into the profession through outreach programs to adolescents and young adults in those shortage areas. And we can also promote and encourage more hygienists to pursue that public health practitioner license. Not many states offer that level of licensure. As we mentioned earlier, 14% of our dentists do volunteer their services. Perhaps we can increase the number that are providing services, especially in those areas with greater need. And perhaps that's looking at establishing or furthering relationships with different community partners to provide, let's say, mobile clinics in shortage and underserved areas. For our part, on the epi side, we'll continue analyzing data from the past and future surveys to keep providing insights into the workforce. Next slide, please. So here are links to the department's oral health program website, as well as the full workforce report if you're interested in learning more. I only touched on a few of the highlights, but there's a lot more detailed information in that report. I just want to say thanks again for inviting me to speak today. It's a pleasure to work with this group and help support their work in advancing oral health care. And I will pass the mic over to Helen, and then we'll do questions at the end. Thank you.
Thank you, Dr. Burroughs. That was very insightful. And you're right, you have only covered just a very limited amount of data that's available in that report. So I encourage all of you to take a look at that, and that will also be shared with the other information from our webinar today. But let's dig a little bit deeper. We're going to hear from Helen Hockey, our Executive Director here at the Pennsylvania Coalition for Oral Health. She has been working in this data and in this just workforce for a long time. And she's going to be able to kind of discuss what this data means as far as trends for the future of our provider pipeline. So take it away, Helen.
All right. Well, thanks, guys, and thank you so much to Nicole and Dr. Burroughs for such a great info. As you all know, it's a passion of the work of the coalition that we do this, and really trying to figure out how we can make sure that the people of Pennsylvania have access to quality dental care. And so I wanted to just start. We've painted the picture a little bit for our current state of events. But I wanted to spend a little bit of time giving some reflection on the changes that we've seen in the numbers over the last decade. So PCOH uses this information to determine trends and next steps. And like I said, we just want to make sure that Pennsylvanians can be taken care of in the years ahead. So the state's been conducting these surveys for many years. I know we've got some providers on the call. So many of you have probably taken part in these surveys when you renew your licensure. So I took the liberty of putting together on one slide the last 6 published reports. So they're all linked. And when you guys get the slides after the call, you'll be able to click into each of them if you would like to learn more or look at the specific individual reports. You will notice there's a gap for 2017. So I don't know how many of you might have already said, wait, where's 2017? That is because there was, as you can very easily see by the look of these reports, there was a change in who was publishing them and who was analyzing the data. So that was sort of like a transitional year. And we are actually actively working on putting together the information for 2017 so that we have that complete picture. But just wanted to let everybody know that that's the reason for the change. And I will say, we often get a question about, there's a lot of different people in the dental workforce. And so why are we focusing just on dentists and hygienists? And I think a lot of that came from the fact that way back in 2009, we did only have 2 types of certifications in the state and licenses, which was dentists and hygienists. So that's sort of why that's gone on, and we haven't added new surveys for positions like dental assistants or EFTAs. And so just something to keep in mind. We would love to see those data collected, but I will just mention, and especially for those who are providers on the call, the state board, when they roll these surveys out, they get complaints from providers who don't want to complete the surveys, and that makes our job really hard. And so if anyone has complained, please tell them to stop complaining. We really need these data to move forward. It is really important stuff. And it's 10 minutes of your time. So it's not a big deal, to do this every 2 years. So there's my little chastise for the group, but just wanted to point that out, that we really need these data, and we want to make sure that the State Board of Dentistry and the Primary Care Office are more than happy to keep asking these questions. So moving forward, We'll go to the next slide here and talk a little bit about, I'm going to start with our dentist and hygienist numbers. So when we look at the last 10 years, where are we at? So these are data that are not necessarily gathered from the reports, the survey reports. So you might see a little bit of discrepancy in the numbers. These are actually pulled from when the state actually has a list of all current licensees. That list can be purchased. And so we are able to do that on an annual basis and look at the individual numbers for how many people have licenses. So to us, it's the best source of actual numbers that can be sort of looked at in real time. And there are a few numbers probably missing because all providers have the option of sort of opting out of that list. And so we do lose some numbers there. But these are two charts that demonstrate when we look at the darker blue numbers, we're talking about all of the dentists and all of the hygienists that have a license in Pennsylvania, right? So that could mean they live in another country, they live in another state, they don't practice here, they've never practiced here, but for some reason they could have a license in our state. And so that happens. We do also have, bordering states that may have, say, a hygienist that lives in Maryland but travels into Pennsylvania to practice every day. So what we do when we look at these lists is we say, okay, what's the total number? And then if we just look at those that list an address in Pennsylvania, what does that look like? So some of those people may actually practice in Pennsylvania, but I would say the majority do not. When we look at the states, somebody who records an address in Oregon is probably not practicing in Pennsylvania, at least not regularly. So these are the numbers, and as you can see, when we compare that, on the dentist side, we see an overall decline over the last decade. I would say a significant decline. And we see pretty much the same level of decline between the overall licensees and the dentists that have Pennsylvania addresses. So I would say that's very consistent. When we look at the hygienists, in terms of all RDHs, those who may live out of state and have a license, we see a more significant decline, whereas it's a little bit more stable for our hygienists with a Pennsylvania license. So, but still an overall decline. And so that's what's the important part here is that we see this decline, and that's not good. We know that we need more providers. So if we can go to the next slide, we're going to look at some encouraging trends as well. And again, you'll see some holes in the data here, mostly because of the way that the state was capturing data over the years. For a few years, we were not able to get the breakdown for public health dental hygienists and expanded function dental assistants. So on the left is our expanded functions dental assistants who've been certified since 2010. And we can see that those numbers have increased over time very consistently, which is great news. We know that those numbers are going up, but we could probably use quite a few more. And then with our public health dental hygiene practitioners, for the folks that, have that certification across the whole country and maybe even out of the country, definitely a strong increase there. That was another position that, as Dr. Burroughs mentioned, was first licensed or certified in 2010. So, we would expect to see that nice rise, but it has continued. So as more hygienists are becoming eligible to apply for that certification, we hope to see that they'll continue to have that number go up. And that's one of the questions I know that Dr. Burroughs mentioned is, do you intend to apply for your certification as a PhDHP? So we are tracking that as well. But again, some great numbers, some good trends. We see the numbers going up. Next slide, please. So with that in mind, I wanted to just share something that I kind of put together, because when we're thinking about, those numbers, and Dr. Burroughs shared a lot of numbers, right, on the percent or the number of providers per 100,000 people. So when we look at that, the standard in what we typically look for in dentists is that we would have 60 dentists per 100,000 people in our population. And so if we look at our current situation, and we break it down based on full-time equivalents, right? So we look at some dentists who may only be practicing 10 or 20 hours a week. for the basis of calculating their availability to the population, that's a half a dentist, not a whole dentist. And so when we base it on how many full-time equivalents do we have of dentists in our state, we're sitting at 6,240 based on our population of 13 million people, and then saying we need 60 dentists per 100,000, we need 7,800 dentists. Okay, now, I don't know if you guys remember way back at the beginning, we said we're graduating 350 dentists a year in Pennsylvania. And we didn't even mention that only about half of them are staying in the state. So if we're only populating our dentist supply at 175 dentists a year for Pennsylvania, it's going to take a really long time to make up that 1,600 that we need. And so that's something to think about, is that the dentist shortage is very real in Pennsylvania, and we definitely need to think about that. Likewise, when we look at our current state of dental hygienists practicing, giving direct patient care, we're sitting at under 8,000. An ideal goal is that for every dentist that you would have 1 to 2 hygienists per dentist, around 1.5, because that's the way that the dental office is going to function, the most efficiently. So we need somewhere between 12 to 15,000 hygienists in the state to be functioning at the right set of where we should be. So again, pretty bad numbers there. And then lastly, we really looked at our Medicaid dentists. So as you all know, we focus a lot on Medicaid trends, and we have about 1,800 dentists that are currently signed on with the Department of Human Services as a Medicaid provider, which is great. We need a lot more than that, though. So thinking about how dentists practice, when you're a dentist and you're practicing and you have a patient ratio or a provider-payer ratio, right? So you're not going to have 2,000 patients and all 2,000 of them have Medicaid. You're going to want some that have private insurance, some that are cash pay, and some that have maybe public insurance. So looking at that and going off of, you wouldn't want to have more than 20% of your patient base having Medicaid insurance, then we would actually need 9,000 dentists to take Medicaid to meet the need of the 3 million people who have Medicaid in our state. Again, those are some pretty dire numbers in terms of where our shortages are. So again, I just wanted to kind of show that where we're at, and then like in a very perfect world where we think everybody would be taken care of fully, that's where we're sitting. So we can move to the next slide. That was not a decade of differences, but just thought it would be a very interesting comparison to make. The other thing we wanted to do is we wanted to look at the makeup of the dentist workforce, because of course that's very important. So there's a lot of information on the slide, but if you look, we're basically comparing the age cohorts between 2015 and 2025. So the wheel on the left, you can see that very lightest color, the lightest blue up in the upper right-hand corner is the pre-1975. So those are dentists who got their license 1975 and earlier, okay? So in 2015, they would have been practicing for 40 years and would be, we would say, of retirement age, right? Likewise, in 2025, same exact thing, except we bump it forward 10 years. So the dentists that were first licensed in 1985 or earlier would also be at retirement age. Okay, so that's how we build up this breakout. I will say that when you look at the two sets of light blue numbers, so our retirement age dentists, very similar, right? So we have not seen a significant change in that space. And then when we move clockwise, those next two colors represent the middle-aged cohort. So those are, and I'll put myself right in there, the dentists that have been practicing for 20 to 40 years, right? So that's that group. That's the sort of experienced dental dentists who've been around, aren't probably anywhere near retirement, but sort of, I always call that, like, that's the really good group, right? That's the numbers we love. And you can see that in 2015, that was 45% of our dentist workforce, but only 33% in 2025, okay? So we lost some of that group that's kind of really well-experienced and practicing, hopefully fully. So then the next section, the slightly younger dentists, those who've been practicing 10 to 20 years, very similar numbers between the 2015 and 2025, so nothing really significant there. But then that last group, the youngest group, which is that purple chunk, those are the ones that have been practicing less than 10 years. So what's interesting is this is where we see a pretty big increase in more recent years. And that's wonderful. That's good news. We have more dentists coming out in those last 10 years, and that's what we really need. So yes, we've lost that chunk of experience in the 20 to 40 group, but we've really gained it in our younger dentists. So if we continue to see those trends, we will be rebuilding the dental workforce, and that's very important. So we can go to the next slide. We did the same thing for dental hygienists to give everybody a little bit of sort of that picture as well. Not a significant change, in some of these different groups, but again, looking at that light blue, which is the oldest cohort, the ones who may be ready for retirement, 5% in 2015, almost 9% in 2025. So what that tells me is that our hygienists are working longer. They're choosing not to retire as much as they were in 2015. I don't know if that's need. I'm not sure if it's just love of the game, but something is happening that our hygienists are hanging around a little bit longer. Then when we move clockwise and we look at those next two cohorts, again, my cohort, the ones who've been out there for 20 to 40 years, you can see that in 2015, 36%, 2025, 35%. Same exact thing, which is interesting compared to the dentist population. Same thing in our next section, 10 to 20 years, similar numbers. So for the hygienists that are practicing from 10 years to 40 years out in the field, nothing has changed. Those groups are very, very similar. We're not seeing big changes there. Now, when we go to the youngest group, which is those practicing less than 10 years, that's where we see an opposite trend to dentists. There's less in 2025 than in 2015. So that kind of scares me a little because I'm wondering if that's maybe due to some burnout. So we have hygienists who have graduated more recently, get out there, start practicing. Did COVID play a part in that? Now that we've seen those numbers have left, right? So we have that smaller group. We don't have the same population coming up. So I'm slightly more concerned about the future of dental hygiene in this space when we look at these numbers as compared to the dentists. Next slide, please. So PCOH wanted to take a look at different years of data and see where the most changes were noticed over time. So I will say this is not 100% reflective of all the greatest discrepancies because those surveys that we've conducted over the last 15 or 20 years have been edited, cut, changed, and so some questions that we might have asked back in 2013, we're not asking anymore. So we can't make that comparison. So, for example, up until 2021, we would ask dentists and hygienists, are you looking to retire in the next 5 years, which was a really good piece of information to have. But starting in 2023, we stopped asking that question. So we can't make that comparison to see if we've gained ground or lost ground. So the data that we use here, we actually use the 2013 and 2023 comparison range, since the 2025 survey results aren't completed and will be completed for a while. So I'm not going to read through all of these. Obviously, everybody can take a look, but just some major things that we wanted to point out in terms of trends. When we talk about retirement age and older dentists, we have a higher amount of older dentists, in 2023. When we look at the trends of, did you go to dental school here? Are you staying here? Or are we attracting dentists who went to dental school in another state? We do see that we have a higher percentage of those attending dental school in Pennsylvania now that we're practicing in 2023. So that's good, but also tells us that we need to make sure our dental schools in Pennsylvania have a lot of Pennsylvania residents going to them. We look at practice in rural counties, so not a significant change there, but definitely a decline. We definitely are seeing less dentists in rural counties. The one thing that, I'm very passionate about and I want to mention is, kids getting to the dentist at age 1. And, it's been a recommendation since 1987, but we still have a significantly high number of dentists who aren't willing to see kids at ages 1, 2, and even 3. So we're tracking, that's one of the questions that's asked on the survey, is at what age do you start seeing kids? And what we're seeing is a pretty significant increase in the percentage of dentists who will not see kids younger than 3. So right now we're sitting at half of our licensed dentists saying, I will not see a kid until age 3. So I think that's something that points out we have a workforce issue that we need to deal with. And the volunteering, of course, wanted to point that out. We've seen some changes in time over the increase in dentists willing to volunteer. And then, of course, I wanted to mention, of course, discrepancies in male-female. As Dr. Burroughs mentioned, we're starting to see those numbers balance out, but still in 2023, we still had a higher percentage of male providers. So we'll go ahead to the next slide just to finish up looking at some of the data specific to hygienists. Again, same thing, we're seeing a much higher cohort of retirement age in the hygiene population, much higher number of those who went to dental hygiene programs in Pennsylvania. Talking a little bit about how many are primarily practicing as a public health hygienist. Interestingly enough, we know that that number has doubled, which is great, but we also know that our public health dental hygiene practitioner numbers have doubled in that time frame. So we're not seeing, even though we have hygienists certified in public health, we're not seeing them actively more going out and working in that space. So I think that tells us there's a little bit of an issue. Our hygienist, historically, it's thought of as a job you can do part-time. So I wanted to look at how many are working less than 30 hours per week. That number's gone down. So we know that hygienists are working more hours, and we know they're working longer, which is very interesting. And then, the female providers piece is very interesting with hygienists. We know historically it's been very tough to get men into the profession. So we've seen a very, very, very tiny change in that, but not very much for 10 years. And the last thing I wanted to mention, saving it for last, is the number of counties where the hygienists outnumber the dentists. That's actually a good thing. That's what we want to see. And so we've seen an improvement there, but still we have 12 counties in our state where the dentists are outnumbering the hygienists, and they can't fully staff an office with those numbers. So something to pay attention to. So we can move on to the next slide, and that sort of sums up some of the data analysis that we have for the next 10 years. Nicole, if you can go ahead to the next slide. There we go. So we wanted to wrap up today. Feel free, if you guys have any questions, throw them in the Q&A as we're wrapping up on this last slide. But wanted to let everybody know, if you weren't aware, that we are moving ahead with a formal speakers bureau, because we want to encourage kids in middle school and high school to start thinking about dental careers. Sometimes that's the thing that puts them in that direction, is just saying it's an option. And so we would love to have volunteers from our dentists and hygienists and FDAs and dental assistants out there who would like to be a part of our speakers bureau, so that if we get a request from a local high school for someone to go in and talk about dental careers, we've got a ton of materials and resources. We can share all that. We just want to find people who can make that connection and be the voice. So we'll share, of course, the information after today, but if you are interested, you can sign up to be a part of our Speakers Bureau. Tell us your preferences for, what counties you would be willing to go to, what days of the week, different things like that, so that we can match up some different groups. Because what we'd really like to do is to see this move forward. We've been doing a lot with the high school pipeline, and it's definitely been identified as a need. So any ways that you all can help us with that, we would very much appreciate it. So we can go ahead to the last slide there. And that's just our final with contact information. If you're not already on our newsletter, of course, make sure you sign up for that and follow us on socials, since we do tend to put a lot of information out around public health dentistry in Pennsylvania. And then I will see if there are any other, I'm not seeing anything else come into Q&A. I know that we were able to answer a question about direct practice there. Any other questions from anyone? Give everybody a minute.